My name is Zoya Teirstein. I'm a reporter for the environmental magazine Grist. I'm here with Marta Segura, the Chief Heat Resiliency Officer for the City of Los Angeles. So I want to talk about, since it's a festival of big ideas, I want to talk about heat as an idea. I know there's an official definition of excessive heat, which is, a combination of humidity and temperatures above the average, but heat also has a personal impact on people. And I'm wondering what that personal impact is for you. What is your association? What is your definition of heat?
Well, I think, as I was growing up, I heard stories from my father and mother because my dad worked in the farms, my mother worked in the cannery. And so there were women fainting, men fainting from exhaustion, from heat exhaustion, dehydration, no breaks. So that left an impression on me. So my first interest in this is through worker health and safety, right? And that's why I have my master's degree in public health and worker health and safety and environmental health. But now I realize the impact is so much greater than workers. It's vulnerable communities that live in historically disinvested communities where the pollution burden is greater, where there's more chronic illness. And because of that, they suffer the greatest ER visits and excess deaths during heat waves. So we want people to know that heat waves are longer, they have more intensity, they're more frequent, so our bodies are less able to recover. And so if you have any vulnerability that I mentioned or others, then that makes you more at risk for being hospitalized or having those preventable deaths. So we want to prevent that. We want to stop that. It's a life and death situation, and we think it can be helped, and we think we can do something about it.
Totally, yeah. I think of heat as one of the most visceral climate impacts. There's a lot of climate impacts that are a little more subtle. Heat is just, it like wallops you,
Yeah.
There's no way to ignore it.
Exactly.
What brought you, Chief Heat Resiliency Officer, I think that's something that people wouldn't normally associate as with being a job that's common out there in the
That's
world. How did that come to be, and how new is the position?
Well, first I was a founding climate emergency mobilization officer for the city.
Okay.
And a year later, the city council wanted to stop the deaths in the city, right? So they're like, this is unacceptable. We need to designate a chief heat officer. So they did a search, and they're like, well, since it's LA's primary climate hazard, why not have Marta Segura also be our chief heat officer? So that's how I came to this dual role of chief heat officer, resilience, as you said, and also climate emergency mobilization director. So I think because LA is #1 in the nation for risk from extreme heat, as defined by FEMA, we have such density in an urban setting. Our urban heat island, combined with pollution, affects more people. So I don't know if you know this, but when you have a heat wave and you combine it with pollution, you stagnate that air pollution and it stays at breathing level. And so these people who have these predispositions, chronic illnesses, are the ones that end up being hospitalized, right? So that's preventable if we have more cooling centers, resilience centers. We have more tree canopy, more shade equity. We have more open space like you have here in Aspen. Our urban core, the historically disinvested areas, have hardly any trees at all, have hardly any open space. So we're trying to transform all of that so that we have healthy and thriving communities for everyone.
Yeah, you've got a tricky situation in LA where you have a lot of urban sprawl, you have car culture, you have a lot of disinvested communities, as you've noted, and some lack of urban green space as well. So you said they brought you in to kind of prevent deaths. Has that happened? Have you succeeded in that endeavor?
We looked at the numbers for the people who came to our cooling centers last year, and more people came to our cooling centers last year than ever before. And it was in areas like South LA and low-income areas of the San Fernando Valley. And we think that's because we had more promotion, we had more engagement, we had a campaign. And you can't count a life that you've saved in this short period of time. That's why I'm pushing for better climate health and equity data. But I do know that more people came for that refuge. And the CDC studies demonstrate that if people who are at risk come for just 3 hours to a cooling center or resilience center, that can prevent hospitalization and death and heat exhaustion and heat stroke. So we know it's a short-term solution. The long-term solution is creating healthier homes for everyone that are heat adapted, that have thermal cooling, that have passive cooling materials. So the city of LA is considering existing building decarbonization policy. We've already passed a new building decarbonization policy. So all those new buildings will be, weatherized, have great cooling materials, heat pumps, everything that you need in everyone's home to adapt to this kind of extreme heat.
Yeah.
So those are some of the things that we're doing to prevent those deaths and hospitalizations.
I'm just thinking about in New York. I mean, I remember like growing up in the city, we'd have a lot of problems getting homeless folks into shelters because oftentimes those shelters were dangerous, et cetera. And I'm thinking of LA, and I mean, you guys have a huge houseless population.
Yeah.
So how do you get, are you getting folks experiencing homelessness into those cooling centers? How are you keeping track of that particular population when it comes to heat?
Well, this year I think we have more like a 2 or 3 pronged approach to address the unhoused. Number one, we're going to have more pop-up stations, taking the cooling stations to where they're at instead of expecting them to come to one of our facilities. So we're getting more of those. Number two, there's already a huge campaign, as I'm sure you've heard. Mayor Karen Bass is bringing folks that are in the house into shelters. Many of them are temporary shelters, but they're shelters nonetheless with cooling. So that's also going to be helping us this summer. The third thing is we have a street medicine program. USC, a local university, is providing triage care, medical care for the unhoused. And they are out there in small cars and golf carts identifying people who look like they are in heat exhaustion or heat stroke and providing those kinds of services. So those are the kinds of programs that we want to increase funding for so that we have less deaths, because the unhoused represent 50% of those that die during heat waves across the nation. So we really know that that's one of our target areas.
I wanted to sort of zoom out and look globally. Something you noted at your panel this morning is that you're one of 10 chief heat resiliency officers around the globe. I'm curious, I mean, in my reporting I find often that people in great positions like you are working in a silo. People are not talking to each other. It's so frustrating. People have knowledge that they need to share with each other, but you're one of 10. That's so interesting to me. Do you guys communicate? Is it a network? How does that work?
Yes, we have a cohort and we meet every month, or if at most every other month. And then we have a meeting planned this September. And we had one last September or last October. So yeah, we constantly though reach out to each other. Like I reach out to Jane Gilbert, I reach out to the woman in Chile Santiago, the chief heat officer in Chile Santiago, and we share information, we share strategies and best practices. But I also have a cohort with C40 and David Hondula from Arizona. He's a chief heat officer in the western part of the country that we communicate with. And then there are resilience officers, as you've stated, who basically do the work of a chief heat officer. And we also exchange information. And we're going to be meeting actually at the end of this month in Los Angeles. So there's all of these amazing cohorts, and we're learning so much from each other and sharing best practices and being on each other's panels too. Like I just invited David Hondula, Dr. Kelly Turner, and Dr. Braden Kay to a panel to talk about the challenges of implementing a heat action plan. And just in that one session, I learned so much, so I know our audience. And there was like almost 200 people who wanted to learn how to implement heat action plans in that audience, right? So it was really cool to, share these best practices. So I'm very fortunate to have a group of people that are smarter than me.
Well, I'm sure that's not true. In my mind, I mean, when I'm thinking about the next challenges associated with climate change, I think often about people, who are coming up with great solutions and then not sharing them, and how that's difficult, especially globally, where you have these silos, these walls up between nations that don't really allow for cross-border sharing of knowledge. It's basically all we have in the face of this threat, right? Like you have to be able to share this stuff.
And I think a lot about climate migration too,
Yes,
and the millions of people that leave their countries of origin because some sort of climate threat forced their economy to crash. And so they're leaving, yes, for economic reasons, but catalyzed by climate change, climate disaster. And we have all these climate refugees. We're taking them in right now in Los Angeles, Texas, Florida. We're not calling them climate refugees, but I believe most of them are. And so if we recognize that by helping other nations, we're actually helping them not need to migrate, which
Right.
helps everyone,
Right.
then I think it's kind of a motivator for our nation to be even more generous and philanthropic in supporting these other nations. And there's also collaboration within the city. So I don't work in a silo in the city either. I work with the emergency management department, the planning department, public works, so many amazing departments that have their own climate infrastructure projects. But what we're doing is bringing that climate equity health lens so that we're all on the same page of where we need to target our climate investments, where we need to see outcomes for healthy, thriving communities, so that, and we're on the same page, but the fact that we actually have this equity index and we're teaching each other how to use this data to demonstrate change and to make these investments is the practice that we really needed. And these conversations that we're having internally are also really helping me.
Yeah.
And I'm grateful for them.
Everyone's talking about El Nino. I've been writing about it a lot. El Nino, La Nina's opposite extreme, it has developed in the Pacific Ocean, which means that much warmer temperatures are on their way. Over the past 3 years, our temperatures globally have been depressed by La Nina, and now we might be entering sort of a new phase of even more extreme heat. I mean, this summer alone, multiple places have already broken heat records. You see Puerto Rico has temperatures that feel like 125 degrees Fahrenheit. That's so hot. But 2024 might be even hotter. So when you look ahead at the future, in the position that you have and the work you've been doing, what comes to mind? What do you feel? I mean, do you feel nervous? Do you feel like we can handle it? And what are the feelings that come up there?
Yeah, feelings of concern, feelings of sometimes like, how are we going to get there, right?
Oh, yeah.
I have to constantly ask that question. How will we get from here to there and make a big difference, right? So, but I think since that's always the question on my mind, how we're going to make it better, and I'm working on it every day, it helps to ease the pain of knowing that climate change is already upon us. Because I'm so busy, like not just reacting, but proactively creating transformation and also addressing some of the short-term concerns, that gives me some level of peace. And that others, so many others, are partaking in this change. It also gives me another level of peace. If I was doing it by myself, I think it would be really heartbreaking. But since I'm doing it with so many amazing partnerships, it gives me some sense of hope.
Thanks, Marta. So great to be here at Aspen Ideas Health with you. Thanks for tuning in.
It was great. Thank you so much.